Expert Perspectives in MBC. The Applicability of ORSERDU in Various Patient Types. Adam M. Brufsky, MD, PhD. Please review the select important safety information shown on the screen. Among SERD clinical trials, EMERALD stands apart in the following ways.
In the EMERALD trial, 100% of patients were treated with prior CDK4/6 inhibitors, 25% were treated with prior chemotherapy, 24% were treated with prior fulvestrant, and patients could have had primary endocrine resistance. Even in a heavily pretreated patient population, we see signals of benefit for ORSERDU in this patient population.
In patients with ESR1 mutations, ORSERDU is also effective in those with liver metastases, multiple sites of metastasis, and higher disease burden.
ORSERDU for ESR1 mutated metastatic breast cancer demonstrated 2 times median progression-free survival with a 45% reduction in risk. In a post-hoc analysis, ORSERDU demonstrated 8.6-month median progression-free survival of patients treated with greater than or equal to 12 months of CDK4/6 inhibitor and endocrine therapy.
ORSERDU data in ESR1 patients who also have a PIK3CA mutation.
I found the data from the post-hoc analysis of EMERALD to be meaningful in many different subgroups, including patients with both ESR1 and PI3 kinase mutations. In the subgroup of metastatic breast cancer patients expressing both ESR1 and PI3 kinase mutations, ORSERDU demonstrated 5.5 months median progression-free survival. The ESR1 mutation is a key driver of disease detected at progression, reflecting the current tumor biology. Ill SERDs, such as ORSERDU, appear to be superior to fulvestrant in multiple clinical studies. Most patients prefer an ILI to an IM injection, making ORSERDU a desirable choice in ESR1 mutated metastatic breast cancer.
There are warnings and precautions with ORSERDU, such as dyslipidemia and embryo-fetal toxicity. Serious adverse reactions occurred in 12% of patients who were treated with ORSERDU. The main adverse reactions seen were nausea and musculoskeletal pain. Indication: ORSERDU, elacestrant, is indicated for the treatment of postmenopausal women or adult men with estrogen receptor, ER-positive, human epidermal growth factor receptor 2, HER2 negative, ESR1 mutated advanced or metastatic breast cancer with disease progression following at least 1 line of endocrine therapy. Important safety information. Warnings and precautions. Dyslipidemia. Hypercholesterolemia and hypertriglyceridemia occurred in patients taking ORSERDU at an incidence of 30% and 27% respectively. The incidence of grade 3 and 4 hypercholesterolemia and hypertriglyceridemia were 0.9% and 2.2% respectively. Monitor lipid profile prior to starting and periodically while taking ORSERDU. Embryo-fetal toxicity. Based on findings in animals and its mechanism of action, ORSERDU can cause fetal harm when administered to a pregnant woman. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Advise male patients with female partners of reproductive potential to use effective contraception during treatment with ORSERDU and for 1 week after the last dose. Adverse reactions. Serious adverse reactions occurred in 12% of patients who received ORSERDU. Serious adverse reactions in greater than 1% of patients who received ORSERDU were musculoskeletal pain, 1.7%, and nausea, 1.3%. Fatal adverse reactions occurred in 1.7% of patients who received ORSERDU, including cardiac arrest, septic shock, diverticulitis, and unknown cause, 1 patient each. The most common adverse reactions, greater than or equal to 10%, including laboratory abnormalities of ORSERDU, were musculoskeletal pain, 41%, nausea, 35%, increased cholesterol, 30%, increased AST, 29%, increased triglycerides, 27%, fatigue, 26%, decreased hemoglobin, 26%, vomiting, 19%, increased ALT, 17%, decreased sodium, 16%, increased creatinine, 16%, decreased appetite, 15%, diarrhea, 13%, headache, 12%, constipation, 12%, abdominal pain, 11%, hot flush, 11%, and dyspepsia, 10%. Drug interactions. Concomitant use with CYP3A4 inducers and/or inhibitors. Avoid concomitant use of strong or moderate CYP3A4 inhibitors with ORSERDU. Avoid concomitant use of strong or moderate CYP3A4 inducers with ORSERDU. Use in specific populations. Lactation. Advise lactating women to not breastfeed during treatment with ORSERDU and for 1 week after the last dose. Hepatic impairment. Avoid use of ORSERDU in patients with severe hepatic impairment, child PUC. Reduce the dose of ORSERDU in patients with moderate hepatic impairment, child PUB. The safety and effectiveness of ORSERDU in pediatric patients have not been established. ORSERDU is available as 345 mg tablets and 86 mg tablets. To report suspected adverse reactions, contact Stemline Therapeutics Incorporated at 1-877-332-7961 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Please see full prescribing information, including patient information.